Good evening, everybody, and welcome. We will get started a minute or two after 7 o'clock to allow people to enter. Once again, good evening to all of you who are joining. It's just a few minutes until 7 o'clock. We'll probably get started at 7:01 or 7:02. We appreciate all of you being with us tonight. Good evening, everyone. Thank you for joining us. It's just about a minute until 7 o'clock. I'm going to give others an opportunity to get on. We'll start about 7:01 or 7:02. Thank you. Good evening, everybody. Thank you for joining us. My name is Scott McAllister. I'm the superintendent of Homewood School District 153. I appreciate all of you being with us. I'm going to give it another minute or two, and then we will go ahead and introduce our other panelists, and we'll get started for the evening. Okay, good evening. Once again, my name is Scott McAllister. I'm the superintendent of Homewood School District 153. It's a pleasure to be speaking with all of you who are in attendance tonight. And just a few items before we introduce our two other panelists. First of all, we are recording this webinar, and the intent, of course, will be to be able to post this on our website once we are done, so that you may want to revisit it, or others who aren't able to be with us this evening can obviously join and watch the same session on a recorded platform. The other thing is we will allow time for questions and answers at the end of the presentation. I am guessing our planned presentation will be about 20 to 30 minutes, depending on how lengthy I and the other panelists are with our speaking. But we do certainly plan to entertain questions, and hopefully we'll go till about 8 o'clock this evening. And if we don't get to some of the questions at that point, we will create a frequently asked question document where we are sure to address all of the questions that come up, because we certainly want to make sure that everyone who returns to us this fall has all their questions answered and they're ready for school. So thank you for being here. It's a pleasure again to speak with all of you. I'd like to introduce the other two individuals who will be a part of our panel this evening. First, let me introduce the Board of Education President, Shelley Marks. Shelley, if you'd like to say hello.
Hi, everyone.
And also, given that COVID is such a health crisis for the state of Illinois and the world for that matter, I thought it'd be good to have one of our nurses here, Jessica Kors, who works at James Hart School. So Jessica, if you'd like to say hello.
Hi there, good evening.
And we have spent a lot of time over the last 15 months, obviously, working with our nurses. We're fortunate to have nurses in all three buildings. And it's been really invaluable to us to have Gail Straney at Willow School. And we have a new nurse at Churchill School, Claudia Marcano, who we're excited to welcome this year. But Pam Lawler before her last year. A lot of time spent with our nurses this year. Certainly when they signed up to be school nurses, they did not anticipate a pandemic. So I've been really grateful to have their expertise with us. So I'll go ahead and get started. And again, there will be time for questions at the end. There's a question and answer box. If you want to toggle on that, you can post questions. So please feel free to do that. And we will answer those once we get to the end. So one of the things that we wanted to emphasize was that this year, in the middle of summer, July 9th specifically, the Department of Public Health came up with a resolution where they fully adopted the guidance of the CDC. And basically, there was a lot to that document. You can go to the CDC website to read details. But really, the key points that we wanted to emphasize for all of you, first and foremost, is that it was very clear that the top priority is to get our students back in school this fall, all of them in person. And so I wanted to point that out in that a lot of the mitigation measures, pardon me, I have to turn off my air. Thank you. That's how you know we're live, when things like that happen. A lot of the mitigation measures that we're going to talk about this evening, last year when we were in the school year, they were pretty clear that you could not have school if you couldn't meet those mitigation measures. Well, now they're placing the priority on getting kids back in school and to do the mitigations as best as possible. So we'll talk more about that over the course of the evening, but that is the highest priority. Second of all, if you read that guidance, they make very, very clear distinctions between guidance for vaccinated individuals and unvaccinated individuals. And there's no question when you think back on the last 15 months, when the pandemic started to take a turn for the better, coincided directly with the introduction of vaccinations into the populace. And so this winter time, January, February, when those started to be made available, is when we started to see the trends take a positive direction. Obviously, in recent days and weeks, we've seen the Delta variant and some of the spikes and the trends headed in the opposite direction. But no doubt, a big point of emphasis is on the importance of vaccinations for putting an end to the pandemic. And finally, the guidance provides language such as should. Schools should do this. And should simply means that it is their health professional recommendation. However, they have allowed each local school district to make determinations that are best for them. And the metrics that they point to are the three that I've mentioned here. Specifically, keep an eye on local positivity rates, and I will share a website for you that we go to and other districts throughout the state of Illinois use to track that. Look at local vaccination rates, and then finally, what are those mitigations that you're using to help control the spread of COVID? So what is different from last school year? Just three highlights that I wanted to point out. First and foremost, last year, as you're all aware, we had a hybrid model of instruction. Basically, students were learning at home while we were trying to meet the mandates of the Illinois Department of Public Health. And then as we were able, we were bringing back kids on a voluntary basis. So we had about 40 to 45% of our families who returned to in-person instruction last spring, but we had another 60% or so that remained remote. Well, the remote option has been removed by the Department of Public Health. And basically, it is only under very, very unique circumstances that schools are to offer remote instruction. Specifically, if a student is not able to get vaccinated and hasn't been vaccinated, and they are under a quarantine. In other words, they're being forced to quarantine because of either being a positive test or a close contact. Those are the only circumstances under which a school has to provide remote instruction. So again, the point of emphasis on getting our kids back in person. Next, if all of you recall, before you dropped your child off at school, you had to check their temperature and go through the symptom list. And then you had to fill out a form or put a wristband on them, which basically confirmed that you had performed that health screening each morning. Those temperature checks and health screenings are no longer mandatory. So we will not be checking for wristbands for our students. We will not be doing temperature screenings. However, let me be very clear that it is still very important for families to be doing those things and to be monitoring the health of your children. The last thing we want, of course, is to have kids who are sick for any reason, but obviously with COVID, to be coming into the school environment. So again, we ask our parents for your support and help in making sure that we keep sick individuals out of our building, but we will not be requiring forms and wristbands for them to come in. And then last but not least, the social distancing. So the rule of thumb has always been 6 feet. Now we wanted to keep a 6-foot distance between individuals. Well, now with this point of emphasis on vaccinations, we are now able to say that people who are vaccinated and asymptomatic are no longer considered a close contact. And the other big thing that I want to point out is if all students are masked in a building, then so long as they're no closer than 3 feet, then those students are not to be considered for contact tracing either. So those are some of the big changes in terms of contact tracing. And our nurses, Jessica again is here, our nurses spent a lot of time, and our administrative teams spent a lot of time contact tracing and trying to identify individuals who were within that 6-foot radius. So hopefully with the more relaxed rules on contact tracing, the number of kids and the number of days missed will greatly diminish. So what is really important, and this is where you see this playing out with school boards across the area, is what are these layers of mitigation that the guidance represents, that they talk about? What are the things that schools should be doing to try to provide the safest environment possible? And what I would like to emphasize, I'm going to try to keep it simple and then I'll kind of go through this list, but the easiest way to think of this is that first and foremost, vaccinations are really, really important. So if we have vaccinated individuals, that is the best mitigation that we can provide. Second is distancing. So as you diminish the distance as per the recommendations, then IDPH recommends you increase the mitigations. So basically, the closer people get together, the more other safety precautions you should introduce. Conversely, if you keep people 10 feet apart, let's say, then some of these other mitigations aren't as important. And so it's very important as we bring back all of our kids. I think every school in the state of Illinois realized there's no way we could have in, let's say, James Hart School, 750 kids in our building 6 feet apart. It's just impossible, right? The square footage doesn't permit that. So what they're saying is we realize the priority is getting kids back in school. So if you have to diminish the space between kids, then you need to increase some of the mitigations that you see here. An analogy that may be helpful to you, and I've seen this used, is think of a slice of Swiss cheese, right? And a slice of Swiss cheese has holes in it. And those holes, that Swiss cheese represents a mitigation layer. And can you see through the slice of Swiss cheese? Yes, you can. But as you continue to add slice after slice after slice, at some point you can no longer see through that block of cheese. And so as you add mitigations, more and more mitigations, you're creating this safety net, if you will. So I just wanted to talk briefly of the many mitigations that we will be doing to safely bring back our students and staff this year. The first one, obviously, is what I mentioned a second ago. Watch your children, make sure that they're healthy before they come to school. That is really, really important. The next one is there's a test that was introduced last year by the University of Illinois called the SHIELD test. And it is a saliva-based test. Basically, it is designed to be a screener. And what a screener is we are going to try to catch asymptomatic people. So people who have COVID and don't even know they have COVID. Because the worst thing is they're attending school every day. not aware that they're a positive case. And in the meantime, they're infecting all the people around them. So the idea of the shield test is to catch asymptomatic people. And there's currently, last year there were a handful of schools. Well, the state of Illinois has found it to be so successful in eliminating or minimizing anyway, quarantine days and the number of students out of school that they have provided the funding for every district in Illinois to do this free of cost, which is just a tremendous, tremendous help. And so we will be doing shield testing for all of our students in the fall. It is not required. So parents, if you want to opt out, you can do so, and we will provide the forms for that. However, we feel that this is an incredibly helpful mitigation to get our kids back here. We will be testing once a week to ensure that we are catching as many asymptomatic individuals as possible. One other thing about the shield test, it will be required for all of our extracurricular participation. So anybody who participates in an after-school activity, given that those activities often are the highest risk of transmission. So for example, picture a basketball game, clearly a high risk of transmission. So we will require all of our athletes and students in non-athletic extracurriculars to participate in the shield. But our goal is to test as many of our 750 students in each building as possible. So there'll be more information coming about that. Jessica, anything that you wanted to mention specifically about the shield that I did not?
I don't think so. I think you covered kind of the overview.
Very good. That was really an opportunity for me to have a drink of water. So thank you. Binax Now is another type of test, albeit a little different. This test is the nasal swab. And this is if we have an individual who actually presents themselves with symptoms. So they come in, they have a fever, they don't feel well. We can do the Binax Now nasal swab and know within 15 to 20 minutes whether or not that student is positive. Again, the goal is to keep as many kids in school by finding and identifying students who are symptomatic and or sick. The remainder of these are all things that you're familiar with, right? Just general good hygiene, hand washing and sanitizing stations. We have those throughout all of our buildings. Contact tracing and isolating individuals who are positive, we've talked about. General cleaning of classrooms, again, will be important. We will have wipes and disinfectant spray available everywhere. Masking, I will talk about further in a second. And then again, distancing to the greatest extent possible. So that means exactly what it says, to the greatest extent possible. We're going to try to separate our kids 3 feet. There may be cases where we're not able to do that. There may be cases where we're able to do that more. We will utilize outdoor spaces, weather permitting and circumstances permitting. So we're going to do everything we can to try to get our kids back to school using these mitigations. So with regard to masking, I know this has been certainly throughout the Chicagoland area. You watch the news every night. There's a story of a district that's answering this question for their population. I'm going to try to keep it as simple as possible. There's really 3 different approaches you can use. You can follow the CDC guidance as it is written, which basically says if an individual is unvaccinated, they must continue to wear masks. They should continue to wear masks. And if an individual is vaccinated, then the CDC guidance says masks are not required. That's one option. The other 2 options are the extremes of those. Option 2, you tell everybody they must mask regardless of vaccination status. Option 3 is you say to everyone, masks are completely optional regardless of vaccination status. And again, if you watch the news, you've seen districts adopting all 3 of these possible outcomes. I've seen places say we're going to require masks of everybody no matter what. I've seen a lot of districts say we're not going to require masks of anybody. And then I've seen some take the middle road. So this summer, we have been piloting, since that guidance came out on July 9th, we have been piloting kind of the middle of the road approach, which is to align with CDC guidelines. I am not a medical doctor, right? So I need to rely on and follow the advice of those people who are. So the CDC and IDPH Obviously, their lives are dependent, or their professions basically call them to protect the public health. So I'm going to follow, and our district has followed from the onset, the recommendations of those health professionals. I know there's also other health agencies, such as the American Academy of Pediatrics, who have recently come out and recommended masking for everybody regardless. So even within the medical profession, there are differing opinions. But again, what I think is very evident is that the more mitigations you have, the safer your building is going to be. So given all of that, my recommendation to the Board of Education at their August 9th meeting is going to be that all of our students, grades pre-K through 8, when they come back to school, all of our students will be wearing masks. Really, the only question for us, at least in my mind, was at James Hart School, because students at Willow and Churchill are not eligible for the vaccination yet. So really, it comes down to James Hart students. And why am I recommending that even if a vaccinated 7th grader, for example, why should they still have to wear a mask? And really, all the things that I've internalized and read, it comes down to this. In our district, 2/3 of our kids still cannot be vaccinated. And even at James Hart, a large number have not been vaccinated. So it's important that, first of all, I would encourage everyone to get vaccinated. However, it is important that we are cognizant that some people aren't, and that includes staff members as well. So we want to make sure we're doing everything to protect the health as best we can. Again, I referenced earlier the Delta variant. You can see the numbers. I'll share them in a second here with you. But there's no doubt that the Delta variant is spiking and causing trends in the direction opposite of what we would like. And then, as I referenced earlier, if all of our students are masked, then the close contact definition is different. And so long as a student is 3 feet or more away, even if they come into that close contact, then those students can remain in school. It's called the exclusion rule. And so I think that's really important when it comes down to keeping our kids in the building. With regard to staff, my recommendation would be that unvaccinated staff must wear a mask. That is in alignment with the CDC guidelines. And vaccinated staff, it is still going to be recommended that all adults wear masks. However, I surveyed our staff because I wanted to get a feel for where they stood on these issues. And our staff, a strong majority, felt that teaching in a mask poses a challenge, especially for our youngest learners. I mean, picture some of our kids in kindergarten and 1st grade who are trying literally to learn to read and write. It's really important. It's more helpful that they are able to see their teacher, to be able to see the lips move, and to hear that without any hindrance. And our staff, several staff commented time and again that their teaching is affected adversely because of a mask. At the same time, I also want to be cognizant of safety. So what I'm proposing is allowing our staff the freedom of taking that mask off, so long as, again, going back to distance, the distance is there. So if I'm at the front of the classroom and I'm teaching my kids and they're sitting at their desks, by all measures of safety, that is an okay thing to do for a vaccinated individual. At the same time, if I'm a staff member walking down the hallway and I'm coming into contact with lots and lots of kids, many of whom are not vaccinated, I think it makes sense to have our adults wearing their masks in the hallway. So that's a distinction that we'll be making and ironing out to make sure all of our staff are aware of that. But the bottom line is we are balancing what I feel is a very, very safe environment with one that is as conducive as possible for student learning. As I alluded to earlier, local positivity rates. We monitor these on a weekly basis in the spring and will continue to do so in the fall. This image is taken from the URL that you see. It's the Northwestern website. Any of you, that is a hyperlink, and once we post this, any of you will be able to go to that website and actually see this data by zip code. So you can enter whatever zip codes you want and check positivity rates. I always look at the Homewood Flossmoor community. So I enter 2 zip codes, and this is the chart that it spits out. And the first thing I'll point out is anything in the green represents below 5%. And so, for several months now, the positivity rates have been good. There is no denying that we have done a good job in this community. I'm really, really proud of everyone who lives here, myself included, at the mask wearing, and that we've had such a positive impact on positivity rates. So that's a kudos to everyone. However, as you can see, looking to the far right corner, you can see that uptick that I referenced earlier. And so even in our community, you see that rise in positivity rates. But we'll be monitoring this on a regular basis. I guess the huge asterisk that I would put on all of this, as it was last year, everything is subject to change, right? And we have to be willing and able to modify based on things such as positivity rates. And this information, which comes from a different website, this is the Cook County Department of Public Health. It's called the Shiny app. But this one is done by village. So on the drop down, you can pull up the village of Homewood. And here's the vaccination data that is reflective of our community. So you can see just over 63% have at least one vaccine, and that represents the total population, including children. So, we're doing a good job of getting vaccinated, but there is still some room for improvement. And again, going back to what the CDC says, the number one way to stop the spread of COVID is through vaccination. It's been proven to be effective. And then 53% are fully vaccinated. Jessica or Shelley, anything that I have left out on either of these slides?
I want to mention that the vaccination percentage is the total population. So that includes children who can't be vaccinated yet. And also, clearly, those that have been vaccinated are creating less of a risk within their own home if they live with people who can't yet be vaccinated. So this is really, really important to keep our community healthy and our schools healthy, to have a vaccinated community.
Jessica, anything?
Not yet.
Okay, very good. You'll get your opportunity, I'm sure, with the Q&A.
Sure.
Okay, some other important items I just wanted to mention. And again, most of this information will be coming from the buildings with more details than what I'm providing. I will mention one of the most important things that the Department of Public Health has provided to schools is a document called an FAQ document, right? So every time a question comes up from a school district, Department of Public Health adds it to their FAQ. And the last update that we had on that FAQ was June 7th. So we've basically been waiting for 6 weeks for additional guidance, especially guidance aligned with the new CDC guidelines. We've been waiting for that patiently, knowing that school for us starts in 3 weeks, and for some other places it starts sooner than that. Well, lo and behold, I went home, I grabbed dinner, I left at 4 o'clock, I came back at 6:15, and in between that little 2-hour window, the new FAQ guidance was released. So at just about 6 o'clock tonight, there was additional guidance. I have honestly not had an opportunity to review it closely. So a lot of the details that you may be asking about with some of these issues will be addressed. I promise we'll get that posted on our website on our return to school document. But I want to make sure that it is accurate and based on the most recent guidance provided to us. So again, we will be getting you some additional details. But generally speaking, we do plan on using lockers and cubbies at our lower buildings. It's an important thing for our students to be able to store their materials. And again, further reiterating that as the distance between kids gets smaller, mitigations need to go up. Another reason for my mask recommendation for all students. Lunch, again, the guidance says we want to spread our kids out as much as possible. You realize when we've typically fed, let's say, 250 James Hart students in one lunch period in one cafeteria, that if we're spreading them out, we're going to need additional space. So we are going to be utilizing classrooms. We are going to be utilizing other large areas such as auxiliary gyms to try to feed our kids and spread them out as best we can. And finally, the guidance, generally speaking, says if you're outside, it's okay to not have a mask. Now, they do have, again, a little bit of a caveat that if there's a lot of people packed into a tiny space outside, it may be a good idea to wear masks. But generally speaking, if we're at a baseball game here in a few weeks and parents are spread out in the bleachers to a reasonable extent, it's fine not to have masks. Buses, this is one thing that the CDC actually came out and said unequivocally, you must wear masks. Everybody must wear masks on our buses. So there's no leeway for local school decision on this. Everyone has to wear a mask on the bus. Bus capacity is limited to 50 individuals. And I will say at this point, I'm just letting everyone know, Kickert, who is our bus provider, they have already notified us that they have a pretty severe shortage of drivers. And so, I'm asking for your patience, but also understand those buses are going to be more crowded because there are fewer buses available. So if you have a way to get your child to whatever school they attend, and you do not need to count on the bus, I ask that you try to do that. That's obviously for health and safety reasons, but it's a real issue and it's going to affect us in a lot of ways. We're going to do the best we can to provide that bus service, but we've already been told. And what I would say is if any of you are looking for a job, Kickert is hiring. So keep that in mind. And then events outside the school day. If we have, for example, an evening band performance, we do plan on limiting attendance to 2 adults per student. So more information coming on that. If you are a guest, if you're a parent or any of our outside vendors who come into our offices or into our building for any reason, we will require masks for everyone who is not a staff member. Again, I mentioned outdoor masks are not required, but spacing recommended. Sports teams, most of our sports, I would say about half of our sports last year were not able to participate. So we're going to follow whatever guidance comes out from the state on sports participation, and that can get pretty complex. When you're outside in the fall, baseball, softball, cross country, for example, it's not nearly the issue, but picture basketball starting in November. And as it exists now, if an individual is not vaccinated, the recommendation is that the basketball player wear a mask. So those are some of the things that the state will be dictating to us, and we will adhere to that guidance. And then, as I mentioned earlier, if you are participating in an extracurricular activity, you will be required to participate in our shield testing. All right, so I appreciate it. I said 20 to 30, and I went a little long there. We're right at 30. But I do want to have an opportunity to answer as many questions as possible. Please know if we don't get to your question, we will create an FAQ document and answer everything so that all of our questions are answered. But I will answer some. Jessica, I'm sure, will answer some. Shelley will answer some. So Shelley, do you want to go ahead and just start the questions?
So I've been keeping a list of questions so that we can get to as many as possible. And one question that's come up a lot is, do our staff have to prove vaccination, or are we just going on their word that they've been vaccinated?
Yes, staff have to prove vaccination. So it's important for safety reasons that if somebody is going to be removing a mask, that we know with certainty that that individual is vaccinated. It is also confidential information. So the only people who know that are, for example, the building nurse and the building administrators. They are the ones that maintain that information. And keep in mind, if an individual, if you see an adult wearing a mask, that's not a telltale sign that that person is not vaccinated, right? There's a lot of vaccinated people, adults, who will be wearing masks, I assure you. So yeah, the answer to the question is yes.
And then along a similar topic, someone asked, I thought all staff had to be vaccinated. Is that not true?
That is not true.
And then we have a lot of questions about the shield test. So let me just mention some of those. How often will the shield test be administered? How is it administered? Who will be performing the test? How long does it take to get results? Why are we allowing people to opt out?
All great questions. I'm going to turn this over to the health professional on the call. Jessica, you want to talk about Shield? She's been our point person for this.
Yeah, sure. So kind of in order, it's hopefully going to be on a weekly basis. We have a third party that is coming in to help us. We've been working with Shield for probably the past 2 months or so to try to pilot the program, and we've been piloting during summer school. So they're coming to each building, and the third party is the one that administers. Now, they are really just the helping to collect, because each individual who's giving a sample, and I'm also participating, Dr. McAllister also is participating, does their own sample. Nobody collects it from the individual. The individual is the only one that has contact with the sample. They get a little tube with a funnel, and you give your saliva sample. It gets scanned. Each individual has a barcode that's assigned to them, and then they place it in the bin, and it gets taken to the lab by the third party. The idea is to get results back anywhere from 5 to 12 hours with a maximum of 24 hours. It just depends on how many samples the lab has that comes in during that time, how fast they can get the results back. Ideally, we would get results back before the next school day so that we could do what we need to do to keep the kids safe and keep anybody quarantined that needs to, depending on masking and distancing and things like that. I think I hit the main ones.
I think you did.
Anything I missed, Shelley?
And then there was
I'm sorry. One thing I'd like to add, Shelley. I'm going to stop sharing this screen because for our purposes, we don't need it anymore.
Okay.
All right. Now you get to see us bigger. Yeah, the other thing I'd add is the most insightful way to learn about the Shield test. They produced a 4-minute video that literally shows a student walking out of their classroom, doing the test, and returning to the classroom. It's really insightful. You know, the old saying, a picture is worth 1,000 words. So we'll send that link out to all of our families so you can actually see what it looks like. There's another 5-minute video from one of the Shield directors just talking about the process. But it's really, really assuring once you watch that video to see how simple it is. And most importantly, again, the layer of security and safety that it provides to us is really, really helpful. So we want to get, I mean, ideally 100%, but there, you know, we realize some people will not want to participate. That's fine. But the more we can get, the better. So we look forward to doing that.
Will we be requiring parental consent for the Binax test?
You want to talk about that, Jess?
Sure. Yeah. So the Binax now is a nasal swab. We have secured about 1,000 tests in the district. That's also provided by the state. The nurses will be administering that test. It is just a nasal swab, not a nasopharyngeal. For anybody who has been swabbed before and feel like your brain got tickled a little bit, it is not that test. It is only in the nares and kind of the outer part of the nose. We will be asking for parental consent before we do any of that. And that would be for any student that comes in or individual staff who has symptoms that develop during the school day. We will also be offering it to anybody who keeps their student at home and would like to get them tested before sending them to school. Be in contact with the school, and we will do it like a drive-up test and have results within 15 minutes. That is a rapid antigen test. It's not a PCR, but in the case of when we're not talking about outbreaks or large community spread, that's a very reliable test.
Again, let me go back to parental consent. So for Shield, the saliva test, we will test all students unless a parent specifically opts out, so says that they do not want to be tested. We're not going to force testing on anybody. Let me be clear, whether it's Shield or Binax. But Binax, we will specifically seek consent before doing it. Okay, so again, we'll put all this on paper, but that's just the distinction there.
What is the percent of vaccinated staff and the percent of vaccinated teachers?
Jessica, I believe you monitor those numbers. So right now, what are we looking at?
We're right around, and all staff is right around 80% of our staff are vaccinated, and probably a little bit higher teacher, but I don't know that exactly.
Thank you.
Will we be informed if there's a case in our children's classroom?
Yes, as we did last year, anytime there is a case in a classroom, we do notify individuals with an email. And specifically, you'll receive a call if it's a close contact. If it's students in the room that weren't a close contact, there'll be an email that's sent, and it'll simply say something to the effect of your child. If you haven't heard from us aside from this, your child was not a close contact. But the answer to the question is yes.
If a child has to stay home because of symptoms or quarantine, will a remote learning option be available to them, or will work be made up when they return to school?
Again, the remote option is for students who are under a quarantine order by the local health department. So basically, they had to quarantine and they were not eligible to be vaccinated. So again, the point of the vaccination, the emphasis on the vaccination is important. Either way, whether it's the answer to the second question, we absolutely will allow them to make up work. That goes without saying. And we will do everything we can to communicate with the family. The question resides in specifically what does remote instruction look like? And again, that's on a very case-by-case basis. But if a student qualified, yes, we would provide an opportunity for them to Zoom into the classroom for core instruction.
Will students have to wear wristbands this year?
No.
Okay. And how often will you reevaluate COVID policies?
It's a great question. I would say on an as needed basis. Certainly positivity rates can change fairly quickly. Our Board of Education meets monthly. We communicate regularly about policy issues, but I would say this, I will be watching it daily. And so, if we start to see that uptick, or, the converse, none of us went into education, and families certainly, we don't go around with masks being the default, right? Like, we don't want masks to be the default. So what can we do to one day shed the masks? So yeah, the goal is that we can get to that point where the health professionals are telling us, you don't need them anymore. I think we all realize we're not there right now. But yeah, we'll be monitoring on a regular basis.
And there's several questions about why can't teachers wear shields instead of being, if they're unmasked, should they be required to wear a shield?
Jessica, do you want to talk about the shields?
Sure. Shields can be used kind of in addition to masks. There hasn't been any data that says that they're as effective as a mask. And so they can be used in addition to, but they're not necessarily in place of a mask. Now, I know that we do have blocks of plexiglass around, and I suspect that we will be using those in classrooms also to create a barrier. Similarly, there's not a whole lot of data, unless it's like a full wall, floor to ceiling, that it's does a whole lot to protect, but it certainly can't hurt. So we do want to provide any sort of barrier that we can. We do have face shields available to teachers, and so we may be using those, and certainly the plexiglass dividers as much as we can.
Can you discuss the cleaning protocol, including the frequency and who's responsible for the classrooms?
Sure. Classrooms are cleaned obviously on a nightly basis. That happens regularly. If there is a confirmed case, like if we find out that there was a student who was positive or symptomatic in a room, we will atomize that room and close it down for a day. So basically, you come in with this spray that kind of like Ghostbusters. If you're old like me and you remember that movie, they come in with this thing and they spray it all around the room, and it kills whatever particulates in the air. But the custodial crew is responsible for that. And then in addition, we make wipes, disinfectant wipes, and then disinfectant spray with paper towel available in every classroom. So and hand sanitizer. So the key is to make those things available, to utilize them as needed. And again, hand washing goes a long way. So I think for the most part, we've learned a lot over the last several months. This is an aerosol-driven virus, right? It's not really been proven to be contracted through surfaces, but nonetheless, that's an extra mitigation layer that's never a bad thing. But all the mitigations together, going back to my Swiss cheese analogy, all the mitigations together provide a nice blanket.
Will staff who are involved with extracurricular activities also be required to take weekly COVID tests?
Participate in SHIELD, yes.
And what will be the procedure for communicating results to parents for the SHIELD test?
Jessica, you've actually handled that.
Mhm. Yeah, so if you hear nothing, no news is good news. If the only people that will be contacted are any positives, our third-party agency that we're working with will probably be the ones to contact the families who tested positive. If for some reason they're not able to get in contact with them, then the school will contact them, and then we will do contact tracing internally as needed, depending on, you know, closeness of students in the classrooms. If everybody's gonna be masking, hopefully we can have everybody's got layered, well-fitting masks every day. So that'll be another good layer of protection.
If we want our child to wear a mask outside, will that be possible?
Yes, we would never tell anybody, adult or student, you cannot wear a mask. I mean, that is always an option. So absolutely, if any adult or if any child wants to wear a mask, by all means.
At what positivity rate will the district make changes?
Yeah, that's a tough one. And we can't say that if we hit this number, then suddenly we're going to change, for the simple reason that those numbers go up and down, as you saw in the graph. So I would hate to be in a situation where we're oscillating back and forth. I think it's more important to look at long-term trends. And right now we're considered in the moderate risk level. Even with a positivity rate that's hovering right at 2%, we still had 47 new cases over the last, the average was 47 cases over the last 7 days, which puts us in that moderate category. So again, we're not going to look at a certain number and say, once we hit there, we're going to change, but rather look at trends.
Will James Hart students be changing for PE in the locker rooms?
Yeah, that's an excellent question. At this point, that's TBD. I am going to defer to the building level administrators. They will certainly publicize that, but right now that is yet to be determined. We were kind of waiting on this FAQ document from IDPH to see if they gave us any additional guidance. So we will be reviewing that.
What happens if a child cannot wear a mask due to health issues?
There are contingencies for that. And the nurses are well equipped to handle those on a case-by-case basis, but there are medical contingencies provided.
Will parents have the option to pick their kids up and have lunch in the car instead of taking their masks off in a large group?
Yeah, I mean, my immediate response would be to say yes. It might provide some challenges for the buildings, but again, I don't see why we would say no to a parent who wanted to pull their child out of school.
Will District 153 mandate vaccines for teachers and staff who work directly with vulnerable and unvaccinated students?
Yeah, at this point, we're not able to mandate vaccinations. That's obviously been a point of contention. I just saw something on the news tonight that the recommendation for health professionals was for mandated vaccines. So education has certainly not got to the point where we have mandated vaccinations for staff. So the immediate answer is no.
Will lunch service be provided?
Yes, lunch will be provided. One of the things last year, you're all aware of the grab and go, the individual packaged brown bags that we provided in all of our buildings. Our plan was to continue with that in the buildings, so individually wrapped. I do believe the most recent guidance allows for us to return to our regular lunch serving, not how kids sit, but the serving lines with the food. So our food service will be reviewing that, but bottom line, we will be feeding kids for sure. Just a question of what that looks like.
Will students be spread 6 feet apart for lunch since they will be unmasked?
As best as possible. And that's where it gets to, again, to utilizing multiple spaces to try to get kids as spread out as we can. I cannot promise 6 feet, but I certainly can promise we will spread them out as best we can, utilizing classrooms, auxiliary gyms, cafeteria, et cetera.
Will parent volunteers be allowed into the building with masking and other requirements? Yeah,
the thought would be, our parents obviously play an important role in the education of our kids, right? So as soon as we can safely do that, we would love to have our parents back. That'll be a building level decision, but certainly anybody who comes in from the outside would be masked.
Will there be a new student orientation?
That's something that each building would handle. And first of all, if you're a new parent, welcome to Homewood School District 153. Yeah, I can speak to the middle school, and I know the other buildings, they meet with families. I know Willow School this year, given the challenge that a lot of our Willow students had, many of them have never stepped foot in Willow School. And that's true even of, some first and second graders. So on the opening day, Willow School will be doing more of an open house type format just to kind of welcome those young kiddos into the room. And as far as new orientation, that will be done on a building basis. And I'll make sure to communicate that with our administrators.
Why can't kids take their masks off if they are spaced apart as well? Can't they take their masks off at their individual desks with enough space between them?
Yeah, again, it's just that added layer of protection, knowing that so many of our kids are not vaccinated. I guess the best answer is that we have a lot of kids, a majority of kids, all of our kids in our lower two buildings, we know are not vaccinated. So that does not mean, however, that kids are going to be wearing masks for 7 hours straight, right? I mean, one of the things that we've learned is we try to build in mask breaks by taking them outside. Obviously, lunch will be a mask break. So those types of things are things that we can build into the school day and that staff will take into consideration.
How will staff unmasking be enforced in classrooms when no adults who know their status can monitor their behavior?
Yeah, that'll be a point where we just have that conversation with all of our staff on opening day, and I will make those expectations clear as far as what we want our staff to do, what safe practice looks like. Again, you're walking that balance between providing the most effective education we can for our kids, while at the same time providing the highest level of safety. And I feel that removing masks with proper distancing is the best way to accomplish that. Is there going to be a quote supervisor in every classroom making sure that happens? No, but I also trust our staff. They're highly professional and they obviously care about their safety and their kids' safety to adhere to those expectations.
When you say 2 attendees per student for after-school evening activities, does that mean 2 adults per student, or does that mean 2 people total, including siblings?
It means two individuals per student. So if Scott McAllister is playing in the band, then I could have 2 individuals come and watch me perform, whether that's an adult or a sibling, 2 individuals.
Is the shield test for extracurricular activities required for all students, including vaccinated students?
That's a great question. Jessica, did you want to talk about the distinction? And I don't know that we've made that distinction, vaccinated individuals versus unvaccinated for shield.
Yeah, so it is recommended for all unvaccinated individuals, but those who are vaccinated are not disqualified to participate. So anybody who wants to participate, even though they're vaccinated, is able. Those who are not vaccinated are going to be the ones that are required to participate in order to participate in SHIELD in order to participate in extracurriculars.
What is the name of the third party that is doing the SHIELD testing?
HR Solutions.
If a child is quarantined because of the SHIELD test, how long will they be quarantined for?
The short answer is 10 days. Sorry, 10 days for anybody who tests positive from the date of their positive test. There are some shortened quarantined if we have, wait, for somebody who's tested positive? No, sorry, I'm going on close contacts also. Anybody who has tested positive will need to quarantine for 10 days following their positive test.
And let me just interject on quarantining rules. It's really complicated. And for myself, I just go to what we call the exclusion guidance, which IDPH has literally a spreadsheet full of rules, depending on every contingency you could imagine. So when a case presents itself, we refer to the exclusion guidance and we follow that. But it does get complicated depending on individual circumstances.
Why are we making the SHIELD test optional?
we can't require people to participate. We're going to encourage it. I think it's been proven to be highly effective in the places that have utilized it, but we cannot require people to participate.
How much time will the Shield test take away from class time, and are tests only if a child shows symptoms?
Shield is the idea is to test anybody who's asymptomatic. So somebody who does not have any symptoms at all, we want to try to catch them from spreading it to anybody else unknowingly. So it won't be for only those that are showing symptoms. It takes approximately 5 to 10 minutes maybe to provide a sample. We piloted it last week, was our first week, and the shortest was probably less than a minute that a student was able to do, and that was a Churchill student. The longest was a Sweet Willow student that took probably about 20 minutes to do it. So it can take a long time. There's a little, we expect there's going to be a learning curve. And as they do it, the more we do it, the easier it'll be. They'll be able to collect as they go into the collection room, and it'll be a little bit easier each time. So I hope the goal is about 5 minutes, no more than 10 is our goal.
And I'll share my personal experience when I did the test. It took me a few times. There will be a learning curve, but next time I'm going in tomorrow, I'm going to nail it. I'm going to know exactly what to do. But it's not as simple as just going and spitting in a cup, to use a common phrase. Takes a little bit of practice. But again, when I first was introduced to the Shield test, my immediate thought was, well, there's no downside to it. They're offering it for free. It is a huge safety layer for us. The one downside is what you just mentioned. Yes, students will miss some class time, but I feel the 5 to 10 minutes once a week that they miss is worth it if it provides that layer of safety for everybody.
These two questions kind of go together. Will the Shield test be conducted before school begins to prevent unknown infections, since families are traveling before the start of school? And do students have to have a negative test result in order to return to school if they test positive or show symptoms or get quarantined?
So before we start in August, is that what we think
Yes.
that question means?
Yeah.
I think that we will probably not begin testing until a couple weeks. Once we get school started, we get all our students back in the building. I suspect we'll start, we haven't set a start date yet. So we'll be talking about that, I guess, is short answer. And then they will not have to get a negative test in order to come back. Once they complete their 10-day isolation after a positive test, it is likely that they'll continue to test positive for several months. So we won't require a negative test. That will be a documented positive for 90 days. If they come in contact with somebody else, they would not be required to quarantine again.
What is an order by the local public health department if our kids are deemed exposed by a close contact in the classroom? Does that qualify as a quarantine order that will provide remote education for the duration?
If somebody has to quarantine and is not eligible for the vaccine, that would qualify for remote instruction. So if somebody doesn't have to quarantine, in other words, they're part of that exclusion, then no, you would not qualify. It's only if somebody has to stay home because of quarantining rules, or obviously a positive test themselves, and they are not eligible for the vaccination, then they would qualify for remote instruction.
Can our children wear face shields in addition to their masks?
Sure.
Yeah, again, we would not ever say you cannot do that.
Can I opt into my kids being tested every week, or are students chosen at random?
For Shield, I assume that, well, I assume that is for Shield. Our plan is we will have everybody who is a student rostered into the Shield program unless a parent opts out. So if I have 20 kids in my second grade class and a parent says, I don't want my child included, we will remove them from the roster. And then the other, as Jessica mentioned, if somebody is vaccinated. So this is largely a James Hart question at this point, but if a student is vaccinated, we still encourage their participation, but they do not have to participate in the Shield test.
What is,
Can I add a little bit onto that? Because I think the question might have been too, like, are we going to choose students at random on a weekly basis, or is it going to be all students that are eligible? All students that are eligible and have opted to participate will be tested on a weekly basis is our goal.
what is the policy for asthmatic kids who need to use aerosolized inhalers?
Yeah, so when we had students in the building last year, I made it very clear to my staff, and I know the other buildings did also, that the nurse's office needed to be a very clean space. So teachers were not just to send students to us. If they had anybody who was experiencing symptoms, they would call to the office and we would go assess them either in the hallway or wherever the student was, in order to keep our space very clean for those exact reasons. Aerosolized albuterol and those sort of asthma medications are a direct access to the lungs. And so we want to make sure that the space where they're using them is a very clean space.
If a family member of a student contracts COVID, but the student does not have COVID, does the student still quarantine?
Yes. Any household contact will be considered a close contact for sure.
If a student is switching classrooms and tests positive, are all the classrooms to be cleaned?
Yes.
Yeah, if they've been in multiple rooms, yes.
Is locker use mandatory, or can children opt out?
Yeah, we don't make somebody use a locker.
How will the playgrounds be maintained?
Yeah, that was one of the questions that came up last year. And again, it goes back to the transmission on surfaces. We will clean the playgrounds as needed, but the best way for playground use is when kids come in, they clean their hands, right? When they go out, they clean their hands. That's the best way to prevent it. We aren't able to maintain our playgrounds outside of the school day. I mean, we can maintain them, but we don't control who is out there. So it's a huge point of emphasis that when kids come in from the playground, that they clean their hands immediately.
There's several questions about substitute teachers. Will we have enough? If a teacher has to quarantine, will we be utilizing outside substitute teachers again? And will those substitutes need to prove if they are vaccinated? And before I give you a chance to answer those questions, I'm just going to put in a plug here. If you would like to be a substitute teacher, let us know, please.
Absolutely. Pays $100 a day, thereabouts. And yeah, we desperately need substitute teachers. I would also say we desperately need crossing guards and bus drivers. So that's a commentary. Yeah, substitutes, we are going to do the best we can to staff our classrooms with substitute teachers. Oftentimes what happens when we don't have sufficient subs, unfortunately, is that our own staff have to cover those classes. And so, yeah, we'll always have a teacher available, but no doubt that the sub shortage creates some issues for us in terms of staffing.
Will parent volunteers be required to prove vaccination status?
No, but masking is required.
Are field trips permitted this year?
Yeah, the field trips, we certainly would like to be able to do those. So again, we're not going to say no. We want to be able to do them safely. So long as it falls within the parameters, the bus guidelines, nothing precludes a field trip.
Is there any ventilation improvements or air purifiers added to classrooms?
The air purifiers were brought into spaces that were deemed by our engineers and custodial crew, operations and maintenance crew, to not have the desired airflow. So we did provide a handful of those purifiers, largely for interior rooms. But all the exchange rates have been looked at by our architects and fall within the guidelines provided.
Will there be a supply drop-off prior to the start of the school year?
That's TBD from the building, so that information will be coming.
And will there be gym this year?
Yes, there will be gym. The big question again for James Hart is will they dress out, and I will have the building follow up with that information. But yes, we will have PE.
Will there be someone in the lunchrooms to help the children who need help at lunchtime?
For sure. We always have adult supervisors.
And let's see. I'm going to give you a chance to answer this question again. I think you already answered it, but I think we can answer it one more time. Shouldn't staff set a good example for students by wearing their masks at all times? Why are we allowing staff to go unmasked in their classrooms?
Yeah, well, I guess the first thing I would say is, the guidance. I'm always going to defer to health professionals, and the health professionals, CDC and IDPH, have said that vaccinated individuals do not need to wear masks, right? We are going against that guidance for students and asking that all of them wear masks for the reasons that I've described. And in terms of staff, I think it really comes down to my desire to provide the best learning experience for our kids, while also recognizing, yeah, what you've said is true. I think it's important that they wear masks when they're able to wear masks, and it doesn't impede on their ability to teach. So that's kind of the general rule. But if I'm in a classroom and I'm trying to do some phonics instruction, it's helpful for kids to be able to see my face. So that would be the reasoning there.
It was said that 1,000 tests were obtained for the rapid test. What if the district runs out? Will more be obtained?
Yes, we can request more on a weekly basis as needed. And as long as supplies last, we can always get more.
Will siblings of a student who tests positive need to quarantine?
Yes, they will fall under the close contacts within a household.
If a child has to do remote for quarantine purposes, would it be their teacher or a separate class just for remote?
There's not going to be a separate class for remote. So the goal would be, if a student is remote, that we set up a camera and allow them to view core instruction in those classes. So basically it would be like a camera in the back of the class watching the teacher and listening to the teacher. And then we would set up a time for some other adult to check in with that student, just to make sure that they're doing okay. The goal, of course, is by greatly minimizing the quarantines through several of the things that we've talked about this evening, that the number of kids who have to do remote instruction is greatly diminished.
Can we request a vaccinated teacher?
No, we're not able to accommodate requests like that. I certainly understand where somebody's coming from, but there's a couple of issues. I can't disclose who is vaccinated and who is not. To be quite honest, that's kept, as I said earlier, with the nurse and the building administration. But to try to manage a schedule, a master schedule, by putting kids with vaccinated teachers versus not vaccinated teachers, it's too many moving parts. And of course, those things can also change. So the easy answer is no, but that's the reasoning behind it.
Are the kids unmasked while doing the shield test?
Ideally, no. You can have your mask on. If I can do a demo, have your mask on and collect from below.
And will teachers be empathetic to the time that it will take if a student is testing? Will this cause class disruption?
We hope not. We hope as little a disruption as possible. We're also going to have it kind of a mobile unit so we can come to the classroom, so if there isn't time lost just traveling to the test from their classrooms. We're going to do whatever we can to kind of make it as easy as possible and not miss very much classroom time.
Will students be going to their specials and walk through the halls? Will they have to wait for another group to pass them before they enter the hall?
We will have students in the hallway at the same time. And again, with masking and with distancing, should not pose a problem.
Will the school district provide laptops for students that have to remote learn in quarantine?
Yeah, we do have devices for every student, as we did last year. We have those devices. So the students will still have devices this year on a one-to-one basis.
Will we know what percentage of families opt out of shield testing?
Yeah, I mean, we'd love to be able to share, well, we will share those numbers with you. I mean, I fully anticipate that it'll be over 90% that are participating, which is a highly effective number.
And approximately how many students will be in each class?
Yeah, we don't anticipate our class sizes changing from previous years. I mean, it obviously depends on the grade level as to how, and the class specifically as to how many kids, but generally speaking, you know, we look at around 20 to 22 is kind of an average, but that's entirely dependent on grade level.
Will all classrooms stream Zoom daily, or will it only be as needed if there's a student who is quarantining and ineligible for vaccination?
On an as needed basis.
Can kids with asthma keep their inhalers on them?
Yes, with proper paperwork on file in the nurse's office, they can keep their inhalers with them.
If there's no significant cost to Zoom, then why wouldn't all students who are absent quarantining have the option to participate in Zoom streams?
Yeah, it's a fair question. It becomes one of logistics. The challenge we had last year was trying to balance. Well, the challenge was for a teacher who was teaching kids on Zoom and teaching kids in person, right? So it was not easy to give proper attention to either group. But the question is certainly one, and I've had this conversation many times. I think the worst thing we can do as a profession is to say, well, okay, COVID is over, even though we know it's not, but one day it will be. Now that it's over, let's go back to February of 2020. So I think the point that you're making is very well taken, which is how can we utilize what we've learned to maybe change the way that we educate a little bit? Really, technology is probably the biggest barrier to being able to do that on a regular basis. You know, setting up the device in the back of the room, et cetera, et cetera. Could we do it on an as needed basis? Yes. Is it something we can pull off in every classroom simultaneously? It would require a little bit of work, but I will say it's certainly worth having that conversation with our administrative group. Like, what are the things that we want to take from this experience of the last, 15, 16 months and continuing into the fall? What are those takeaways that have been of benefit and that we can continue?
Will children be allowed to bring in outside food for lunch?
Yeah, the biggest issue we face with outside food, of course, is just allergens. But students are not only allowed to bring their own lunch, encouraged, and we do have the allergy-free table as we always have. But yeah, absolutely, people can bring in their own food.
These two questions are similar. Will there be longer quarantine requirements for students traveling into hot zone states? And if a family travels out of state during the school year, is the student required to quarantine when they return?
It's a little tricky. Enforcement's a little tricky. We definitely recommend quarantining, but it will be on a family's choice to do so.
Since all children have devices, will there be snow days? Or will we utilize Zoom on those days?
Yeah, that's a great question. So pre-COVID, the state came out with something called e-learning days. I don't want to cause confusion, but remote learning is not an e-learning day, right? Remote learning is what we did last year. E-learning days were this pre-COVID thing to address exactly what you're talking about, right? Like, there are districts that have basically remote learning, we'll just call it what it is, for snow days. We do have an approved e-learning plan in place. So the state has looked at our plan. They've said it's okay. It's in place for 3 years. So as the bad weather approaches this fall, we will definitely have that discussion. It is nice to be able to say, you know what, we see the forecast, tomorrow's likely to be, or certainly could be, a day where we don't come into attendance, and have an e-learning plan in place that kids can learn from home. The big advantage, of course, is that we know we're not going to add school days at the end of the year if we pursue that e-learning option. The downside, of course, is everybody loves a snow day, right? I mean, that was one of the great memories of childhood. So, my gut tells me at this point we would pursue the e-learning option. But we'll definitely publicize that more when inclement weather starts to arrive.
Is the third-party vendor following HIPAA regulations? Typically, consent is needed to obtain confidential information being shared with outside organizations. How can we be assured health information is not being disclosed inappropriately?
Jessica, did you?
Well,
Yeah, we can talk about the process. I mean, and again, I've experienced it. The video that we'll send home, you'll see that everybody is barcoded. You know, my name is on the roster, so they know that my sample goes in this test tube, and then I am the one that puts that test tube into the rack that then goes to the laboratory. We have a dashboard, if you will, that basically presents the results each night when the test is conducted. So yeah, they're well aware of HIPAA guidelines and regulations, and obviously are sworn to uphold those. So we are notified of positive cases so that we can obviously keep that individual out of school to provide the safest environment. But yeah, that third-party provider knows HIPAA regulations, and we have to trust that they adhere to those.
they have also signed a contract with Shield, as we have, to abide by all those laws.
Will more outdoor time be incorporated into the school day when weather allows?
Yeah, the goal is obviously to take advantage of that. So staff would be encouraged, as we talked about, it's a good opportunity to get masks off if we're able to get outside for a little bit. So yes, we will encourage staff to take advantage of that.
Our class was not able to finish all the curriculum last year due to virtual difficulties. Will teachers be taking that into consideration and helping kids catch up to grade level?
Yeah, it's a great question, right? The infamous learning loss that you've heard so much about. So yeah, one of the primary things that we want to accomplish at the start of the year is to assess our students, to see where they are. And then, yeah, that's the art of teaching, right? A great teacher is going to meet kids where they are. And that's going to be a really big task this year. One of the things that this federal money is allowing us to do is to be able to try to catch kids up by utilizing things like after-school programs. Our summer school program was very robust this year. So the easy answer is yes, we'll be assessing our kids and then doing the best we can to get them on task, but also to treat a fourth grader like a fourth grader and not a third grader.
We had to pay tech fees this year. Does that mean children will be working off of devices assigned to them throughout the day? Will they be using those devices rather than textbooks for sanitary reasons?
Yeah, students will have access to a one-to-one device. We still have textbooks that obviously students will have as well, but every student will have a device, if I'm understanding that question correctly.
And are we working with the Park District and 161 regarding guidelines for extra innings?
We are working with the Park District. We met with them earlier this summer to devise our extra innings program. So I know that we are working on transportation to get our kiddos there after school and the before school programs. We do communicate with 161 also on a variety of issues. The guidelines that I've talked about tonight for masking align with 161. So, we're consistent in that regard and communicate frequently with them and the Park District.
Will a student be sent home if they refuse the Binax test? As I understand it, the test is for children who appear sick. So if a test is refused, will the child be sent home when they have symptoms?
After assessment, if the nurse in the building determines that they are at risk and they don't want to have a test, then yes, they will be sent home.
Will you limit the number of kids performing the test at the same time to limit any contamination with masks being off or loosened?
Yes, everybody will be socially distanced during the testing.
Okay. And the last question on here, and I realize that we may not have gotten to every single question. I tried to put in the questions that many of you asked or that were not specific to one child. We will go back through all these questions and you will get an answer. We'll also be publishing FAQs. So if we didn't get to your question, please know that it will be answered in one way or another. How will returning to school after breaks work? I would think it is very likely students will either be traveling or be getting together with people outside of their home more. Will the whole school wait to return after breaks? And this kind of goes along with what we already discussed about quarantining if you're going to a hot state.
Yeah, and I think it's important to remember also, again, that positivity rates are 2%. You know, last year when we were having this discussion at wintertime or spring break, you know, the positivities were 2, 3, 4 times higher than that. That's not to say things are great right now, right? The trend is the wrong direction, but still, if you look at it holistically, we're in a lot better place now. And we didn't shut down after breaks then. I think the key is just to be diligent regardless of the time period, right? To follow the mitigations, to do the screenings at home. And again, I can't emphasize that enough. It's important for parents to monitor their own children and keep them home if necessary. But we'll continue to do due diligence on our end to make sure that that we're doing everything we can to provide the safest environment.
Those are all of our questions. And I know that Dr. McAllister wants to have some final words. I want to just say that just like last school year, the safety and health of our staff and students is our number one priority. And we are going to do everything we can to keep everyone as safe and healthy as they can possibly be when they are in our buildings. We also know that part of being healthy for children is being in school. And we want to provide that opportunity for our kids to be in school and to learn with us. We know that to make this work, we're all going to have to work together. We need people to have their kids get the shield test. We need everyone to get vaccinated. And we need to all be working together so that our schools can do what we do best, help children learn and develop appropriately each year. So please work with us to make these things happen so we can make great things happen for your kids. Our staff, as you know, worked so hard last year to make this work for your children, and they will be working equally as hard this year. They need your support, and they're looking forward to that. Also, I want to mention that we will have a board meeting on Monday, August 9th at 7 o'clock, and it is in the James Hart Learning Center. If you would like to attend, come. We are also broadcasting those on YouTube. So please feel free to join us. We like seeing your faces.
Yeah, thank you, Shelley. And again, I was watching the participant numbers this evening, and it was really an outstanding turnout, which tells me how much you care, how interested you are, right? And that's what makes this community wonderful. That's what makes every one of us who work here want to be here for you and for your kids. And I know this is not easy. I realize when I go to bed at night, the decisions I make are going to upset some people. People are going to disagree with that. I also hope that you understand they're made with 100% the best of intentions, right? Like we are all in this together, as Shelley mentioned. We're really blessed to have, as you can hear tonight with Jessica and our other nurses who I mentioned earlier, Gail and Claudia at the other buildings, we have health professionals in our buildings working with our kids. I mean, this has been a Herculean task to try to stay on top of this, but they've done a marvelous job. And again, as Shelley mentioned, our staff has just gone way, way above and beyond for the last year. And I think all of us are really excited. We're excited to have our kids back. It's kind of a difficult feeling to describe walking through a school building with no kids. And it's kind of like a punch in the gut that we all experienced last year. So to have our students back is exciting. And we want to make sure we do so safely. So I thank you all for coming tonight and listening. This will be posted. There is a return to school document that is on our website right now. That's the old version. We will be revising it over the next 2 weeks, and we'll get that up in early August so that it has all this information in one concise document. And again, we will be addressing the questions that we've gotten. We'll create an FAQ within categories to try to cluster your eyes if you have a specific topic you're looking for. So we'll be working on that as well. But we are always here for you by email, phone call, and we want to make sure that you are comfortable with your kids coming back to us. So with that, I appreciate all of you coming, and we look forward to working with you this year. Have a wonderful night.
Take care, everyone.
Bye.